Hi everyone, welcome to our mental health video for the month of June. As you can see, I'm joined by a beautiful guest, Sister Doxine, and so she will be joining me today to talk about the topic of hoarding. Do you want to say hi to the folks,
Yeah,
Doxine?
of course. Hi, everyone. So happy to see you and looking forward to getting this talk started.
Hi. So, Sister Doxine, do you have any specific curiosities or questions about hoarding that you'd like me to start with?
Well, I have a million questions to start off, but I guess I'll start with the first question. What is hoarding? What is it? Could you define it for us?
So a simple way to define hoarding is when a person has a psychological drive to accumulate and save things. That's a simple way of putting. So it's more of a person's psychology and how they view things and the meaning behind the objects. And it's possible for someone to hoard things, but also animals as well.
Okay, because I've always been really interested on the impact that our environment has on our mental health.
Mhm.
Um, could you perhaps elaborate a little bit on that, on how exactly could hoarding impact us mentally? Um,
Hmm. So in terms of environment, one of the risk factors actually of someone developing hoarding behaviors could be from their home environment, from
mm,
when they were raised during childhood, right? If you were raised in an environment that was oftentimes cluttered, where a parent or family member did not throw away anything, they lived in a very isolated setting, and those objects was their emotional connection to things, disorganizations. Those are certain things that can enable or influence or put someone at risk of becoming a hoarder. So
mm.
the environment, similar to many other things in our life, can impact also someone's hoarding behaviors as well.
Okay. So would you say that, I'm just trying to understand here. So the environment definitely, it definitely affects the individual mentally. And I'm assuming it also affects the people that live in that kind of environment as well, correct?
Absolutely. So the mental aspect is one piece of it as well, right? Part of it as well is around personality because you can have multiple children grow up in the same family, same household, same behavior, same parents, and one may have hoarding and the other one doesn't. So the environment is one piece. The personality is also another piece. And there hasn't been a lot of research on hoarding yet, and it's a fairly new disorder. So these are information that are currently, they're more theoretical in most sense, meaning that most of them haven't been proven yet because this is a fairly new behavior that's been recognized as an
Yeah.
actual disorder. And so one of the personality pieces for someone who tends to be a hoarder, it's someone who may lack some executive functioning ability. So it's like the front part of the brain about reasoning, making decisions. Um, a lot of hoarders tend to struggle with making decisions, processing, to be able to problem solve certain things. And those are some characteristics that makes it very hard for someone who loves to accumulate and save things. There's
Mhm.
also the physical impact, right? If your home is cluttered, it's going to increase your isolation because sometimes there's an element of shame that comes with how the way your house look. If it's cluttered, you may not want people in your home, right? And
Yeah.
so that creates that isolation. Depending on how cluttered your home is, you're at risk of potentially something falling on you or getting hurt. And so there are a lot of different risk factors and different impacts that can really affect the person's functioning. And that is the key difference between someone who's a collector
Mhm.
or a hoarder, right? Someone who collects things, there's an element of order to it. It's on display. It doesn't disrupt their functioning. And a hoarder, it's more clutter. There's not a lot of organization from someone looking in, and it affects their ability to function in that space where they live.
Okay. Um, Now the question that I have is, if you're living with a hoarder, and I mean, and you just so happen to be the complete opposite, right? You're a person that's very organized, a person who, likes everything sparkling clean and whatnot.
Mm.
Um, how could you go about, um, for example, if you wanted to help an individual like that, is it possible for you to help someone like that, or how would you go about doing that?
It's in terms of helping and treatment, I think it really depends on the person that you live with. Do they believe that there's a hoarding issue? Like any other mental health struggle, the first part, in my opinion and in my experience, is admitting that there's actually a problem. So one of
Hmm.
the challenges with living with someone who's a hoarder is that they don't view it as a problem, because with someone who's a hoarder, all of those items and all of those possessions, there's an emotional attachment to it. It's almost like their baby, right?
Hmm.
It's the value that they place on it tends to be tenfold than the person who's living with them. So if they don't see it as a problem, definitely it will affect the relationship. And it's not uncommon um, that hoarders tend to live alone. That's why most of them live alone, because most loved ones are not able to get their needs met or function in a place that is overly cluttered. And
Right.
so, unfortunately, if the person is in denial that there is a problem, it's going to be very difficult to help that person. Sometimes it's about setting boundaries. Sometimes it's about trying to love them through it and understand them through it. However, to say that they're going to change that behavior, if they don't buy into it, it's going to be very, very difficult for someone to help that person.
Okay.
It's going to require them to change their mindset, change their behavior, and look at the emotional connection that they have to those items.
So if I'm understanding you correctly, the first step would be to recognize that they actually do have an issue,
Yeah,
correct?
yeah,
Okay.
yeah. This is where sometimes it's challenging for families, because there's a difference between having hoarding behaviors and
Mhm.
having a hoarding disorder, right? A disorder is diagnosed by a psychiatrist, so I would encourage people not to use Google Doctor to diagnose themselves or diagnose family members. Someone may be disorganized, someone may be messy, someone may accumulate things, but they're not hoarders, right? There are specific criteria that would diagnose someone with a hoarder. And some of those criteria would be it's a behavior that's persistent. So it's over a long amount of time, right?
Mhm.
So the hoarding behavior, for instance, it's a persistent difficulty for someone to throw things away or part with any kind of possession. And they
Right.
could be objects or they could be animals. Someone who hoard animals could have up to 20 cats or dogs or birds or stuff in their home.
Mhm.
Um, and so the value that they place on it, like I said, imagine something that you love to your core. Imagine
Mhm.
how hard it would be to part with that object, right? And so someone who's a hoarder, it's almost like those objects are their family, almost like their baby, like a parent and a child. And so the idea of discarding an animal or discarding an object, imagine the grief and the loss and the trauma that could come from that.
Okay.
And a lot of people who are that attached are people who have experienced loss or trauma, or some kind of hurt or really tragic pain over the years, that they've become connected more to objects. And that connection to objects sometimes minimize any connection they may have to humans, because in human relationships, the possibility of hurt is even bigger. It makes them more vulnerable, right? So
Mm.
it's that over long-term inability to throw away things
Mhm.
that are important to you.
Mhm.
The value that they place on those things are superseded. I would say more rational
Yeah.
perspective than the average person. And the idea of throwing things away would cause them to go into crisis, actually. So those
Yeah.
are at least three of the key components that a psychiatrist would use to help them to diagnose if someone has hoarding or not, is a hoarder or not.
Yeah, you touched on something really interesting. I'm wondering, maybe you can perhaps talk a little bit more about this, but um, individuals that are hoarders, do you think it could be connected to a childhood of poverty? I know a lot of people who, are very transparent about a childhood of having a childhood where they didn't have very much.
Mhm.
And so when now in their adulthood they have these things, they hold on to them because as a child they didn't have the luxury of having some things. And even when they're broken, or when they're, obviously they have no more use, they're still determined on keeping those things because it's of so much value to them.
Yeah.
So do you think you could talk a little bit more about that, like that connection,
Mhm.
hoarder and poverty? How does that work together?
And this is where sometimes when you talk to someone, so there's some people, for instance, and I'm sure we all know someone in their life who, if something's on sale, they buy for a rainy day.
Hmm.
And so some people would call that person a hoarder. Or if they're walking somewhere and they find a picture frame or something, well, I'm going to keep it just in case. That doesn't necessarily make someone a hoarder. It's more about the functioning, is the behavior and the gathering and accumulation of objects or animals. Are those things, are those things affecting their ability to function well, right? To go to work, to do school, to live a healthy life, to be physical, to live in the space the way it was meant to. And so someone growing up in poverty won't necessarily have ordinate abilities. However, someone who grew up in a deprived environment could lead to that. So it is a potential risk factor. And so once again, one plus one doesn't equal two when it comes to a lot of mental health. It's more about what are some risk factors. And yeah, a childhood that's deprived of either a lot of affection or financial pieces, or physical connection, those could actually put someone at risk to develop those behaviors at a later date. And when it comes to hoarding is oftentimes to see before your young adult years. Because even if a child or a teenager is a hoarder, most times it's hard to know because your parents always tell you go clean your room. Is it that you're
Mm-hmm.
messy or is that you're hoarding? And so when someone starts becoming an adult and more into the later 50s towards mature age to seniors, that's when a family member may start seeing these hoarding behaviors, right?
Hmm.
Because they're just gathering and gathering and gathering and they're letting nothing go,
Hmm.
right?
Hmm.
And they may not even be aware of what they're doing.
Hmm. Yeah. Very, very, very true. Very interesting facts that you're bringing here. I'm also wondering about whether or not, hoarding actually affects certain age groups. Um, I personally, I tend to see it more in the later years, but perhaps I'm wrong. Maybe it's something that young people can struggle with just as much as older people. Talk a little bit about that.
It's right now is as I mentioned before, right now, most of the research that's been done has been proven that folks in their 50s, 55 years and older tend to be the highest population when of people who are diagnosed with hoarding. And so, they start accumulating things because it's a lot harder to diagnose earlier. Just because of, as I mentioned before, your caregiver or parent may say, go clean your room. And so if you don't observe these behavior over a long period of time, is the person being disorganized? Are they disorganized or are they hoarders? So um, 55 and older, people tend to have more fixed environments. So you're able to over a certain time monitor those behaviors and see those things, and hard to get rid of things. And based on some of the research as well, is that the older someone gets, the more loss that they experience in their life, right? And so loss and grief is very much connected. to one of the risk factors for hoarding. And so, what can you control? Hoarding is also about what can you control, where you can control what you bring into your home, what you hold on into your environment. And so the more of those things that a person may deal with, the more they may hold on to these things and develop that emotional connection, because there is some safety in loving those objects that safety may not be there in loving a person, because that person has control in that relationship, where with an object you're the dominant person. And so over time that emotional connection becomes so great. And so the older you get, based on research right now, that's what's being shown out there.
Okay.
Yeah. So this is
I guess.
why when it comes to treatment, it's very, very tricky. It's almost, someone may almost say that hoarding is almost an addictive behavior, right?
Mm.
And so when it comes to treatment, do you treat it because it's similar to obsessive compulsive behavior? Do you treat it because it's very similar to addiction behavior? So this is why treatment, if someone hasn't bought into it, it can be very, very complicated. But psychotherapy is one of those. Psychotherapy and medication, or medication and psychotherapy, those are typically what's used to treat someone with hoarding disorder.
Almarine, I guess the question, and I'm sure a lot of people are thinking this in their mind right now, and you may have already even touched on some of these signs, but for that person out there that's wondering, could I be a hoarder?
Mm-hmm.
You know, kind of elaborate and perhaps give us a little bit of some information on what are the signs when a person has a hoarding disorder. And perhaps, as I said, you may have already mentioned some of those things, but could you just list them again for those people out there that are just wondering, okay, is this me or is it not me?
Mm-hmm. And once again, I'm going to reiterate, is even though I list these signs, doesn't mean that you're a hoarder, right? If you really want to know if you have just hoarding symptoms or behaviors or disorder, it's very much to meet with a psychiatrist who is able to diagnose you. So please don't start labeling yourself. Please don't start thinking a certain thing about yourself without getting confirmation. So a couple signs that we typically see would be, first, they may not invite someone over to their home, as I mentioned before, because they're ashamed of their home. It's so cluttered. They also don't want feedback from someone who's going to tell them or judge them based on what their home looks like. So a lot of times there's that isolation or withdrawal. And so guests are not invited over to their home. They would rather go to someone's home or leave the home and meet someone socially than have someone into their home. Another sign could be, excuse me, another sign could be is that the home is so congested that the living area or the way the area is meant to be used can't be used. So they may not be able to cook in the kitchen. They may not be able to sleep in their room or on their bed because there's stuff everywhere. Their couch may not even be very visible. Their living room can't be lived in or watch TV in because there's stuff everywhere. So if your living area is not being used the way it was intended, then that could be a sign as well that someone's struggling with hoarding. Another sign could also be is that they're unable to throw anything away, right? It could be from a newspaper. It could be from a bottle cap. This is where if they're noticing that a lot of their thinking or attachment are irrational, then that could be a sign that they're hoarders. And so them gathering things and never throwing anything out and putting a higher value on those objects, right? It's not just love. It's almost like an obsessive value where they would say this is worth this much or this means this much to me, when to the average person, it's just a bottle cap. So those are some quick signs to kind of say, something may be problematic here. We may want to investigate this a little bit more. And I guess one thing that I forgot as well is just feedback from your loved ones. If these are loved ones that you trust and that you believe in on an average day, and these
Mhm.
are loved ones who are telling you, I'm worried about you. I think there's a problem here. I think you have a problem with hoarding. You may want to trust them. If you find yourself trusting them with everything else but these possessions, that could also be a sign to say, wait a minute, right? Why am I not trusting their feedback or their opinion or advice on these particular things, right? So, in a nutshell, that's pretty much what Orden is. I don't know if you have any like last curiosity.
I guess the treatment, what does the treatment look like for hoarders? If could you give us some information on that?
The typical treatment would be either medication or psychotherapy or both.
Okay.
For me and from my experience and research has shown that medication alone does nothing to fix or cure or help someone manage anything. It might take the edge off. It may help them to focus better or concentrate to be able to take certain steps. But remember, hoarding is an emotional, it's about having an emotional attachment. And so there are obviously some emotional needs that need to be addressed. And so psychotherapy would definitely be one thing that is recommended and that has been proven to be very helpful. Okay.
Great. Well, thank you very much, Almarine, for sharing all of this information with us today. As a lot of you, as you know, our church theme for 2023 is walking out a new normal, living right and living well. And so if you enjoyed this video, please do like the video and subscribe if you haven't subscribed already. And if you enjoyed this video, I'm pretty sure you'll enjoy the previous video that was done a few months ago on
And the
emotional
other
wellness,
ones over the past 3 years.
and the other that have been done over the past 3 years. So please do check those out, and see you in the next one. Bye.
And I'm just going to add something that if ever you do need some support with hoarding or you have some concerns about hoarding behavior or someone who you love who may be struggling, reach out to us at the church. And as you know, the number is 613-745-HOPE, 613-745-HOPE. And I want to thank Sister Doxine for having this conversation with me. And I wish everyone watching happy mental health in June and for the rest of the year. Take care, everyone. Bye.
Bye.